Hey there, are you having some hand numbness, whether it's the back of your hand or the palms of your hands or the tips of your fingers? My name is Huang with Hands-On Therapy Services. I'm going to share with you some of what I have been finding so often in my clinic. Right now, a lot of people are working all the time, or they're just getting a lot of stress right here. But they are all of a sudden feeling a lot of numbness in their hands and in the back of their hands. So I want to share with you what I'm finding. Here's my little whiteboard that I use often with my students, but I just want to show you that. So this is our bodies, right? I'm gonna let's see. I'm gonna show. Okay, this is our arms. This is our body. This is our legs, right? So nothing crazy, but let me show you. So a lot of people are coming to us and they're telling us, my hands hurt. Hands hurt, or they're numb, right? It's my chicken scratch for you. So what's happening here is their hands are hurting or their hands are numb, and usually what brings people in is they start not being able to sleep. It drives them crazy. They can't do the things they enjoy doing, whether it be take care of their family or work, right? You got to work in order to take care of your family, and you want to take care of your family so that you can actually get stuff done. So what we're hearing is a lot of people have, their hands are coming in and they are hurting. It's numb, it's the back of the hand, it's the tips of the fingers. Now, what's really important to understand here is you can be stuck here at your hands, right? You can be stuck at your elbow, you can be stuck at your shoulder, and you can definitely be stuck at your neck. These are potential problem spots when you have any kind of numbness. Now, there's three main nerves that go from your neck into your arm. I don't want to necessarily go into real specifics about it right now on this video, but I can for you. What I'm finding out is if you have numbness on the back of your hand, usually if you have numbness on the back of your back of hands, it's one particular nerve, and it's called the radial nerve. And I don't want to go into like specific crazy details, but I just want you to be aware with that nerve, sometimes it's really hard to find, right? It's really hard to diagnose. There's no real tests that can really show it because it's got tons of little branches, but I just want you to know it's very possible to get rid of that numbness and tingling so that you can sleep, so that you can work at the computer, so you can cook and take care of your families. What's most important is finding out what is going on. Is it at the hand and wrist level? So if it's at the hand and wrist level, it's gonna be stuck around here. It can be stuck here around your elbow. It could be stuck at your shoulder and be stuck at your neck. It's really important for you to go to someone who's gonna be able to take a look at everything and be able to get you clear in terms of what's wrong. Because if we know what is wrong, we can actually help you to get you right on the right path to fix it. Right? So my name is Huang here at Hands-On Therapy Services, and we can really help you do that. So let me share with you a really common thing that I actually saw a ton in the last several weeks. So with that particular nerve, right? If we find out you have that particular nerve, it's important to go nice and gentle. It's not the same. I was just telling a patient today, yesterday, that it's not always, you know, no pain, no gain. That is a very particular idea when you're working out, because the idea is like your muscles are burning, you're working out, you got to stay motivated. So it's that mentality of no pain, no gain. That does not apply to when you have a nerve problem. So if you've got numbness and tingling and someone's like going to town on you, or you're maybe doing it yourself and you're just going really aggressive, try to do it a little bit more gentle. One of the things I like to do is I like to take a look at the skin. So we can look at the skin, we can look at the fascia, we can look at the muscles, right? There's so many areas to look at, but let's just take a look at our skin first. And sometimes when your skin is stuck down to all those different layers of tissue, you can get stuck, and that's what's going to cause some of the numbness. So try doing a gentle massage. See if you pull your skin down just a little bit, if that feels better. If you pull your skin up a little bit, if that feels better. And actually several months ago, sometimes people are stuck going to the side, right? So it's really important to figure out what is going on and what is wrong. And then it takes figuring out what works, right? Because it's so completely possible to figure out what's going on, get clear on what's wrong, so you can get the right kind of help. If you are someone who's having some numbness and you just don't want it to get worse, then give us a call here at Hands-On Therapy Services and we can help you figure out what's wrong and where, right? And if you've been suffering for months, it's still okay. It's very possible to get rid of those problems that you're having. If you're having hand pain or hand numbness, it's totally possible. But in the meantime, until you can come in, until you decide to come in, check on how your skin is moving, and then let me know how that works for you. All right, I will talk to you soon. If you like videos like this, you can always hit the subscribe button, and if you're looking for true help, you can always give us a call, and I'm gonna include that link down below for you.